everybody, today we're going to talk about intervertebral disc disease. So it's IVDD. But of course, we learned about it before it was ever called IVDD. That's a newish thing. But anyway, there's acute intervertebral disc disease, and then there's chronic intervertebral disc disease. So acute disc disease means that your, say, Dachshund or Frenchie, or there's a lot of breed sensitivities, maybe Corgi, a long back dog with abnormal vertebral column, just genetically. So I don't know if you guys can see this, but there's there's the green, and it goes up into the silver. And so that's, the green is the disc and the silver is the spinal cord. So what ends up happening to these dogs, they lose deep pain and they go paralyzed, which is a very, very, very difficult situation, obviously, for both surgery and for holistic vets. But then also it can be not as bad as that. They could just have some discogenic pain. So there's all kinds of nerves in this area. And I'm pointing at this area because T13L1, that kind of area is probably one of the most common areas that we rupture an acute disc. But we also get, and that's because the vertebral column changes there, and the angles, the facet angles change. So it's an area of, unless the dog has a lot of muscle tone, goes to physical therapy or swim therapy, this is an area of a lot of weakness.
So this is little Frida. Frida's 14. She has a history of occasional back pain, more discogenic pain. Her diet has been dialed in for a lot of years because she has liver issues, thyroid issues, adrenal issues, and she's doing really well now. But anyway, this is her when she's 14, and this is Fit Paws, so you can see how strong her core is here, and it helps her back. She also has medial patella luxations, and it helps those too. So she's doing really, really well, really because of this, not because her back is great genetically. So.
And tendons and ligaments throughout the spine that a lot of times even the dogs that have predisposition to getting disc disease won't. So having your dog be strong, maybe they can go with you to Pilates class, that'd be good. But the other areas that get acute disc herniation are are C7, so right where the cervical meets the thoracic. We can also get other kinds of disc herniations up in the neck. It's very common. And then we do get some in the lumbar spine too. So it's just, probably this is the most common, second most common, maybe third most common, and fourth most common. As far as areas that are affected. And so what we do is, as veterinarians, is we look for nerve function. So we might do a conscious proprioception test, see if they can position. I'll show a video of that.
So this dog is a dog that ended up having a spinal tumor. And I guess what I'm doing is I'm showing you guys that you cannot tell based on clinical signs at all whether these dogs have a spinal tumor, like this poor dog, or if they have just a regular disc. But in holistic medicine, acupuncture and maybe gentle chiropractic herbs, they're very, very good for disc disease, but they're not good for spinal tumors. So this dog had a spinal tumor, but the x-rays didn't show it, and it ended up this dog had to have an MRI, which showed it really clearly that the nerves were obliterated by a tumor. And so it's super sad, and I'm super thankful to these guys for letting me use this video, even though we couldn't save this dog. But I'm showing here the conscious proprioception test, which basically means that the dog can either feel where his foot is or not feel where his foot is. And then here I'm showing an exercise that I have clients do where you basically flex the leg, check the CPs. If the dog doesn't feel the CPs, then you do just a slight pinch on the toe. So even though this dog has a tumor, you can see there is a little bit of improvement through working with the nerves. Obviously, it's not as good as if the dog only had a disc. And at this point, I didn't know what the dog had. We were just going to try, usually what I'll do is I'll try 3 acupunctures on these guys, and if I'm not getting anywhere, then I will refer them to a neurologist and an MRI, though the cost, of course, is a lot higher. And this dog, I think, was 10, so they opted not to do surgery. Surgery doesn't necessarily save the mobility of the dog. A lot of times they have to have sometimes it can help with it, and that's great, and sometimes it can help with pain, but a lot of times they have to have a cart after surgery. So I don't want anyone to think that if they spend a $10,000 or $20,000, they're going to have a mobile dog at the end and that they'll be normal. They won't a lot of times. So it's really important to realize that, especially with a spinal tumor. This one was inoperable. So yeah, you have a number of rule outs with basically the same symptoms. They can have ataxia, where they walk like a drunken sailor. They can have full-on paralysis. So this is another dog's spinal tumor that you could see with an x-ray. It was a little tumor up on the spine that you could see there at the TL junction. So this is more what I usually see, what I'd rather see, because this dog was cured completely. And this is a very severe disc situation. This dog, Maggie, she couldn't hold herself up in the back end at all. But you can see she has a little bit of movement. It's kind of spastic. She's an ataxic dog at this point. You can see evidence of urine scalding. See the red by her hock. That's very typical of these dogs. Will start not just urine scalding if they can't hold their urine or poop, but also they'll drag their leg, and that's can cause ulcers. It can cause infection. So the management of these dogs until you get them cured can be quite cumbersome for a lot of people. In this case, our main focus was we did acupuncture and gentle chiropractic, weight loss, homemade diet, herbs for strengthening the spine, and this is a CP that's negative. See there, she cannot feel that, but I do a little pinch and she can write it. So her nerves are not as far gone, obviously, as the other dog, at least in this video. We didn't take a video when it was really bad.
So if they can position their
Thanks so
back
much.
legs when you position their leg on their foot on the top of their foot, they can position it then themselves to stand upright. And conscious proprioception is one of the first signs of basically neurologic dysfunction. So for acute discs, sometimes they need surgery. A lot of times they don't, even though it seems like they should. Acupuncture and even our gentle chiropractic that we do, I'll try to show some videos. Here at the clinic, we do chiropractic for disc herniations, but we also have almost 30 years of experience working with discs. Okay, so this is Baxter, and he's a 4.5-year-old Frenchie Staffordshire mix. And he has a pretty significant, very significant disc herniation in his neck. And so I just wanted to show everyone what I'm doing to help his neck. And it's going to be a lot of mobility, and I'm just not going to talk while I'm doing it because I want to concentrate what I'm doing. But basically, his atlas and his whole right side of his neck is completely stuck and not moving at all, even though he's on a lot of medication. So let's see what we can do. I'm gonna try to unstick that atlas. So it's moved in a funny direction. It's kind of at a 45-degree angle. So we're gonna just, okay, did you guys see it? That was a chiropractic adjustment. So my whole point is that I want people to know that chiropractic adjustments can be very, very, very subtle. And in fact, probably almost none, you can't really even tell. But he can tell. So I'm gonna also feel his occiput. Okay, there's also occiput issues on the left. That's the back of the skull. Now I'm going to see if I just adjust the atlas, does that make the rest of the spine feel better on that side? hopefully. His like C2, C3, all of it is not moving. So now I'm gonna adjust C2. See, that's it. That's all we're gonna do. We don't need to make him crank his head around or any crazy stuff. He's got a disc herniation, so we have to be really, really careful. And I think he's trying to protect it right now. Okay, so this is gonna be like grass growing for people. Really boring. Okay, so let me see how this is moving now. I'm still not happy with that. But it's okay, it's better. Okay. I did a slight shoulder adjustment, and now I'm trying to open up the space in the. Okay, so now let's see what happens. How's that feel, Baxter? So some of these dogs end up getting surgery, and sometimes that's a good way to go, but I wish that everybody would try the non-surgical route first, you know, because a lot of dogs wouldn't need surgery, and that would probably be a good idea. And sometimes people can't afford surgery too. Okay, so now I'm going to try to work on this part of his head, his neck, his cranium, with working on this. So let's see if we'll wait, good boy, wait. So we're going to work on the sacrum. Okay, so we're going to work on the sacrum. Okay, did you guys see that adjustment? No, of course you didn't. That's because it's so mild. So important though, because otherwise his spine is just completely, it's like his shoulders and his head are too big for his spine, if that makes sense. So let me just do a little more back here, if it'll let me. Okay, bud. And also it shouldn't hurt, you know, there should be no pain. Just going to try to straighten his head out and feel it again. Okay. Now we're going to try and feel the low cervical. Oh, he's so tight on that side, even with all these meds. Anyway, we're just gonna see this side. See how this side moves really easily, no problem. This side's like, whoa. Okay, does that move better? So the shoulder gets involved with the low cervical discs, right? Because the shoulder, what happens is the muscles, it's not held on by a real joint, it's held on by muscles, and so the muscles get all tight in there, and then they just take that shoulder. And so if I can get the shoulder loosened up, then I can get into the low cervicals. Okay, let's see how that is now. Does that feel better? That feels a lot better. Okay, now what I do is I do acupuncture to help hold it. I'm gonna do acupuncture to help hold it. I think we're just gonna go ahead and see if he'll let me just do it. And if he's goofy about it, then Tim, I'm gonna have you come back over again. Plan B. Plan B. bladder 10 on the right. And gallbladder 21 on the right. And then bladder 10 on the left. And gallbladder 21 on the left. See if I'm happy with that. Yeah, pretty happy with that. So I'm just going to see if the energy's flowing. It's better. And now I found another stuck spot, so I'm going to try to free that one up. And I'm going to see if they'll let me do this one point. That is really good for those stuck necks. But like I just met him, so who knows? Poor kid. Okay, let's see if he'll let me. Kibble Baxter. Triple heater 3. Triple heater 3. Right here, this point right here helps with cervical discs. See you guys, see this point? I'm gonna come back and we're gonna do some acupuncture here. This is his kidney point, one of my points that's also stuck. That's good. Now I'm going to try and do bladder 40 to help open up the whole spine. Good boy. Good boy. I know. Okay, and anyway, this was what medicine could look like. What do you think? One day in about 50 years?
Hopefully, love.
All right, well, we can stop it and then.
3, Maggie move! Maggie move! Okay, Maggie move, come this way. Maggie move, this way. Woo! So she does a little bit of rabbit hopping. Come on, honey. Good. Good girl. Good girl. Can you walk up on the scale? Come on. Good girl. Yeah, your foster mom's been so good. Up, 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 up. Up, 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 up. Do you know how to get up, up, up? She's like, heck no. You're trying to kill me. I know. Jeez, come on. Up we go. Wait. 6, 15, 8. That's fantastic. I know she almost weighed, I think she weighed close to 30 pounds at one point. Come on, honey. Here we go. Good girl. Let's get up on the table. Let's have a treatment.
Quentin! Here, Quint! Over here. Come on, Quint!
Acupuncture is always safe to do. So then there's the chronic disc herniation. So those are the ones that have more like osteophytes and calcium deposits and ventral bridging and all kinds of pathology along the spine. And then those guys, they may have disc disease, but it may not be like an acute situation where they jump down and they, the green went into the silver. Instead, it might be just that the green is always in a little bit of a wrong position. This disc is in a little bit of a wrong position, and the dog may tweak the back in certain ways because he's not protected again. But for both acute and chronic, no matter what, we put them on the dogs, and I guess the cats, we've seen it in cats, it's not as common, but on an anti-inflammatory diet. You guys have heard me talk about it a lot, but basically super important here where we're giving them whole foods, foods that don't cause inflammation or aggravate inflammation. And the dogs that are on those diets, those whole food diets, homemade diets, raw diets, with a lot of vegetables that are really healthy for them, and also ground up ligaments and organ meats and regular meat. So just following a raw diet. These dogs, and it could be cooked diet too, these dogs heal so fast from disc disease, whether it's acute or chronic. So the diet, especially one that's dialed in with all the antioxidants. So we're talking about vitamin E, and usually we do that from our vitamin mixture. You guys can watch that video as well. But vitamin E, vitamin A and D, vitamin C. So you kind of go through all the antioxidants that are really good for the spine. In addition, we do put them on chondroprotective agents, or we'll do ataxic injections localized into the points, and I'll show a video on how I do that. I do that a little differently than most vets. And yeah, that's intervertebral disc disease. It used to be one of the most common things that acupuncture vets did, and now I think it's more like immune-mediated diseases and allergies, but disc disease is probably the #1 reason to go find a veterinary acupuncturist. It's a phenomenal way of controlling it. Usually within just 5 sessions, the dogs are using their back legs again. They're not in as much pain. So it's really, really rewarding, especially when you couple it with the diet and herbs. So anyway, you guys, please share this video. Please subscribe. It's a great way of paying us back. Thank you so much. Have a great day.